I'm so having a brain fart right now. All right, so this is just more of our A&P. All right, so once we go down the larynx, then we go into our trachea, and then from there, we're going to be going into the lungs. And it's going to take us all the way down, eventually, until we get to the alveolar. Is that blurry for you? Need glasses?
No, it's blurry.
Even with my All right, so we have the right lung, the left lung, and then we have the apex, which is going to be the top. The base, which both runs along the diaphragm, and then we have the diaphragm. Our alveolar sacs, alveoli. What happens in the body when we breathe in and when we breathe out? Yep. So then we have our acid-base balance. So this is just a respiratory, right? So respiratory acidosis is going to happen when you hypoventilate, and alkalosis is going to happen when you hyperventilate. When you are hyperventilating, what's going on is that you are trapping all of that base.
No, you're releasing to the
You have a urine alkalosis.
Because
You're blowing off.
You're blowing off, thank you. Thank you, Danny. That's exactly what I was trying to remember, that terminology. And I put it in. Well, we have a webpage open if anybody wants to go back and take a look at it. Our effects of aging, our health history, what's up. I know we've seen this before, but this again is like the that assessment that I want you to kind of know to ask patients. All right, so when we are doing our inspection, especially on a respiratory patient, this is what's going to be super important. So we need to make sure that while they're breathing, it's symmetric. Is one side of their chest going up while the other side is not? What is their color? Are they cyanotic? Everybody knows what cyanotic means?
Mm-hmm.
Okay. Is cyanosis easy to spot on everyone?
No.
Why? Right, so like, depending on how much melanin somebody has, is going to depend on whether or not you can see through blue. The use of the accessory muscles, and then the dips, so these are going to be your different respiration rates. And if you pay attention to these rates, you're going to see that they do have stuff in common with cardiac. So you're going to see that we have like tachy and brady, apnea. It just is whether or not we're having issues breathing or not breathing. Does anybody know what kind of different shapes the chest can make on its own? Or just one? Barrel chested, yeah. So when you palpate, when we're palpating, we're doing two things. We are looking to see if they're grimacing. So let's say we're palpating the sinuses. If they are full, like there's like a sinus infection going on, they're going to grimace. It's going to be very painful for them. The other thing too is if we're going to be searching for crepitus, so when we're kind of doing that palpation like they're doing here on the back, we're gonna be searching for crepitus. That's kind of like the sound of somebody smashing a potato chips in the back. So as you're like pressing on them, it's gonna sound like you're smashing potato chips. Percussing. So, I don't know, not a huge fan of percussing. I think it's a bit outdated. So what you're gonna do is you're gonna kind of tap on somebody's chest and you wanna hear if it's dull or if there's like an echo. I think it's a bit outdated, that's just me. Auscultation, so this is, we're gonna be checking to see if they have normal breath sounds, adventitious sounds, and then we're gonna check both sides, the back, to make sure that they are the same. That would be normal, and if they're not, then we're gonna have to document the different sounds. Examples of adventitious breath sounds. So, starting off strong is gonna be our crackles, coarse and fine. Can anybody tell me the difference between coarse and fine crackles? So fine crackles are gonna be soft, and it's gonna sound like you're pulling apart Velcro. And coarse crackles are gonna be loud, and it's gonna sound like moist bubbling. Wheezing, stridor, does anybody know what stridor is? Say again?
Like the whistle sound.
It's like a really, yes. When you are, she didn't die, but, when a patient is breathing in, you're gonna hear stridor. It's almost like, it's like there's a blockage and the air alone isn't getting in. And it almost sounds like the patient's on their deathbed. You'll know because it's one of the scariest sounds you'll ever hear. We're like, when you listen to wheezing, it's kind of like somebody's whistling, but like, I have a link where you guys can listen to all of these. You guys were brought into the lab though, right? And you guys listened to everything in the lab?
Briefly.
All right, I'll send you guys a link. I'll upload it into the show. Friction rub, diminish, breath sounds or absent. So here's a couple of different lab tests that they're gonna do to check, let's say, oxygen levels, really overall just the entire respiratory state of somebody. Say again?
Legionella.
Oh, something similar, all right. Then we have chest x-ray, CT scans. I know you guys have already heard of all this. So smoking cessation is gonna be a huge one when it comes to respiratory. So they can do behavior modifications such as quitting, there's counseling, they can set the date, they can do nicotine replacement, drug therapy, hypnosis, physical activity instead of smoking, and then there's e-cigarettes, which have since been shown to cause brain cancer and other cancers. Does anyone in here vape?
Chris, raise your hand. Cassie better have her hand up too. All out. I'm not gonna be the only one.
Talk about throwing under the bus.
She's checking.
I do.
Where does the hypnosis work? I
No.
mean, it depends on what you believe, but like.
I didn't expect to see that.
I don't lose 80 pounds with hypnosis.
And that's what I was gonna say, like, It works for some people, it doesn't work for others.
I think you believe it's gonna work, it's gonna work, right?
Yeah, I
Be
mean,
like clear-minded and
and
not
I'm
stressed out.
100% the
and
person
be
that's like,
able to
I'll try it.
Only under the best.
I mean, I believe in strategy, so it's not like I'm. All right, therapeutic measures, deep breathing and coughing, huff coughing, autogenic drainage, breathing exercises, thank you, and pursed lip breathing. Positioning, so we can put them in fowlers, semi-fowlers, and then good lung down. So if somebody is gonna get, let's say, a thoracentesis, and they're gonna end up with some type, or chest tube, and they're gonna end up with some kind of puncture in the lung, then we can lay them on the side of the good lung. Does that make sense?
Yeah.
Yes.
Okay. O2 therapy, you can go nasal cannula, oxygen mask, or a trach. Here are your 4 different types of masks. The difference of these masks are whether or not, it depends all on the port, and it's like a valve. And this is your trach. This is a woman getting a nab. This is a woman who's doing an inhaler. This, we're gonna call it a child, that's using the spacer with the inhaler. This is the incentive spirometer. So for this one, you have to breathe in, and you have to try to raise the balls. There's one that you suck and there's one that you blow. So remember it that way, because that's how we remember it in school. Chest physiotherapy, this is going to be like chest PT, right? This is when they start to kind of do that massaging and I don't want to say like padding, but it's like a harder type of padding to try to break up any kind of secretions. It's really cool, right? Yeah, and it actually does kind of like get movement in the secretions and gets them out. This is going to be your PEEP device. So there is a vest, and then again we talked about a thoracentesis. So chest drainage. We're going to talk about indications, the insertion of a chest tube, drainage system, and then nursing care. So this here is the drainage system. So what ends up happening is that we have the chest tube that is going to be inserted into the patient, and then on the other end, it is going to be absorbed to usually the wall that is suction. In between those in the patient and then in the wall is going to be this collection device. So what ends up happening is that we are collecting whatever blood and fluid we are from the chest. And then we have our water seal itself. And then we have our suction chamber. So really what that is that it's creating enough pressure where we're able to get everything out of the chest, let's say by gravity, and we're not pulling it out too fast, too hard, to where we're damaging the inside of the patient's lungs. So there's your water seal, your suction chamber, your drainage. When we have somebody that has a chest tube, we need to make sure that that drainage collection device always remains below the waist of a patient. That's going to be really important. The other thing too is when you see one of these real ones, there's going to be like measuring units that are going to be going on. And after the end of each shift, the nurse has to initial where she left it, all the way up, and that's how you're gonna be able to record like how much they got in 24 hours or in 8 hours, so it has to go all the way up. The other thing too is that you don't ever wanna kick one of these things over. Like, you will be the #1 ostracized nurse. And on, like, you'll probably get written up if you knock it over. It's like a big no-no. You knock it over, then you risk screwing up all the measurements, but most of all, ripping it out of the patient's chest. So, just FYI. On the beds, especially those medical beds, down towards the feet, there's like a metal bar that usually has like circles on the top. And these devices usually have hooks, and you can just hook it right in. You'll see it, it'll be fun. Your first day on the job, they're not gonna do a chest patient, I promise. If they do, just quit. They're setting you up for failure. All right, let's see, a tracheostomy. So the tube is inserted into the opening of your trachea to maintain patency. So we're gonna be suctioning from that. There is going to be a lot of copious secretions. We are 100% gonna want to make sure that it's clean. We have to tell the patient that we are gonna suction, and eventually we're gonna wanna teach the patient how to do it themselves. These are your different types of trachs. Those metal trachs, you're gonna see they're a little bit, they're like, let's call them first generation. But you are 100% gonna see these in people who have had this, let's say, 30 years. They honestly could take out the trach and like suction like their skin. Like, they're like so healed and the body's so used to it. Here's our nursing diagnoses for the trach. So the Passi-Murr, this is the speaking valve. I don't know if you guys are aware of this, but this is what goes on underneath the vocal cords. So it's just gonna be what pretty much looks like, it has like rubber tubing, kind of like blood tubes do. And this is how they're gonna either get air in or out. Well, they get it in through the valve and out through their nose. They can be intubated. Usually this is gonna happen depending on if you call a code. Depending on what kind of code you call, anesthesia will show up, and they're gonna be ready to intubate no matter what. Mechanical ventilation. So unfortunately, this is gonna be for somebody who we are gonna want to before. And these are gonna be all of your nursing care. So you don't ever wanna go below 30 degrees on the bed. Oral care is going to be huge. They are not gonna be able to do it themselves. And usually when someone's on mechanical ventilation, there's like a whiteboard or a notebook next to the bed, and they're usually able to communicate that way. This is going to be a positive pressure ventilation. So have you guys like heard of CPAPs? Mm-hmm. It's like that. Do you guys read these when you go home?
No, I don't.
I appreciate your honesty. What occurs in response to negative pressure in the thoracic cavity?
I would say.
Wait, no. Three. Pick three below.
Three. Which acid-base imbalance results from impaired respiratory function?
Respiratory acidosis.
Yeah. Which adventitious breath sound is generated by narrow inflamed airways?
Strider.
Or
Or no, wheezes.
I feel like we just give me
smoking cessation.
Nicotine replacement, behavior modification, hypnosis. No.
Yeah, okay.
Which intervention can help patients expirate their sputum? The light's going on. Can you guys tell me 2 therapeutic breathing techniques that we talked about? What? Pursed lip breathing, yep. Breathing techniques.
Smelling the flowers blowing.
Yeah.
What's that?
No. We had pursed lip breathing, and then there's a different type of breathing. Come here, here. It was, diaphragmatic? Yeah. Diaphragmatic. Yeah. Can somebody tell me what fine crackle sounds like? And what about corks?
Hard butter.
Moist bubbling.
That's what you say.
2 diagnostic tests to evaluate respiratory function. Yep, and chest, did you say x-ray? Chest x-ray, yep. 2 signs that your patient might need suctioning. They're not coughing yet. Did you say lung sounds? Yes. Yeah, so it's adventitious, yep, breath sounds, and what's going on with their O2 sat? Dropping. Yeah. Let's see. Can pursed lip breathing help improve exhalation? Exhale.
Yes.
I'm having such a brain dead day. Yeah, thank you. Does it reduce air trapping? Pursed lip breathing?
Yeah.
Yeah. Yep. Do you guys know what in the brain regulates breathing? It is not the hypothalamus.
Oh my gosh. You're right. Is it the medulla?
It is the medulla.
Oh,
And
And I want to say the central?
it's the one with the P. No,
No.
the pons.
Yes.
That's just like the
question again, so what was the question?
The question was, what are the 2 pieces of the brain that regulate breathing?
The medulla and the palms.
Yeah.
Okay.
PONS. PONS. That's a trivia question in case anybody wants to know. Do you guys know which breath sound is mostly associated with pneumonia? Think of pneumonia.
What?
Aren't these all tricky?
Straight.
You're right, it's wet, what?
Aren't these all just tricky?
They're just good questions, aren't they?
Oh.
Do you think they're good test questions? Yeah, I thought so. What do you guys think? What kind of crackles? I love that. All right. But that medulla and pons one is really a trivia question. I really liked it. It's like, shit, how come, I mean, I don't play trivia, I'm not that smart, but I wish that question came from me. If you had a patient that had airway obstruction, what do you guys think that you would see? What would you hear? Did you say nothing? Yeah. You would definitely hear Strider, and I do appreciate nothing. Yeah, Strider's one. What do you think, what do you think the color of their skin would be?
Blue.
Thank you.
Cyanide.
Thank you. And do you guys think that you're gonna see like retractions?
Yeah,
Like probably some nasal flaring and, yeah. I agree with those three things. Do you guys agree with those three things?
yeah.
Strider cyanosis.
Holy freaking COPD. What do you guys hear when you have somebody who's having an asthma attack?
Wheezing.
How would you describe wheezing? And high pitch, did you say high pitch squeaking?
Yeah.
That is exactly how you would describe wheezing. Yeah, squeaking or whistling sounds.
That's what I was.
Nice job. What medication prevents wheezing? What does it do? It is a bronchodilator. Ty, I see you today. It opens up the airways.
I isn't bad.
And then, does it decrease coughing episodes?
Yeah.
It sure does. Because it is, it's like a rapid response to reduce bronchoconstriction. So if you were having an asthma attack, what is the first line med? Albuterol. Yeah. Would you give it like in a jet nebulizer, which is just the actual albuterol, like the puff, or would you like give it to them in a neb? You're gonna give it to them in a jet.
I'm saying it's a matter of
They're like, they're having an asthma attack. You want them to get 100% of the med, and who cares about the moist air coming with it? Jet nebulizer. We went over mechanical ventilation. What did I say the lowest degree the head of the bed can go on?
30.
Thank you. If you have somebody who is on mechanical ventilation, what is going to be one of the highest nursing priorities? That is, yeah, that is one, but there's one that with your ABCs is gonna be more important.
Is that an airway?
How do you get a, somebody said it, how do you, suction. Suction the airway. Um, I lied to you guys. I said the drainage, the chest tube for that drainage container. Did I say below the waist?
Yeah.
Below the waist or below the chest? What did I say?
You said below the waist, which is below the chest.
It's the chest. I'm sorry, guys. It's the chest. It's the chest. So sorry. Did you guys learn, in fundamentals, did you guys learn about chest tubes and water seals?
A little bit.
Did they tell you about watering, like what bubbling in the water seal?
Like we went in the lab.
What happened?
I mean, we went in the lab one time. They showed us it. I don't remember it, but yeah.
Do you remember?
It's like a whole being or
Leak.
a leak.
Yeah, so if you see bubbling in the water chamber, it means that there's a leak somewhere. No bueno, you gotta like let the nurse know ASAP. ASAP, it's supposed to just like be stagnant water sitting there. I think that might. I think that's it. Anybody have any questions right now? All right, so we are back tomorrow, right? Yeah. 2 hours?
Yeah.
I am going to upload those breath sounds for you guys. And we will do chapter 13. And then I will grade your test.